It's very nice, Rich, and thanks. I was asked to come this morning to talk about the Mind Care program, which actually Mind Care to me would be a nice preference to iris. We have peonies and we have iris. We have lots of flowers in springtime in Wisconsin. That's wonderful, but I do think that seriously, Mind Care would have sent a very strong message. Iris, we kind of scratch our heads. State makes up these interesting names, don't they? Iris may be the kid sister of family care. Family care also has a stepchild, which is referred to as self-directed support. When the legislature passed family care, they put this little sentences in. Each member may arrange for, manage, and monitor his or her family care benefit. That's the self-directed support component. And it's a component of family care. When Scott Walker talked about how Milwaukee County has made a significant difference and has maintained affordability and cost effectiveness, one of the things that he didn't mention is what the Milwaukee County folks have shared with us in their early response to being a pilot program. One of the ways that they were successfully able to help people return to their homes from nursing homes and prevent people from going into nursing homes was the use of self-directed support. Was working directly with families, with individuals, and saying to them, this is a partnership. And I really do love the way Representative Rose described her vision of Mind Care. It's simply families and individuals with support would know that they have the resources and the support to create a life that makes sense to them. We continually forget the expertise that families and individuals have. I certainly have done that over the years as a professional, as a case manager when I started in my career, in the variety of jobs I had. Sometimes we get caught in terms of how much we know, and we truly forget. We give lip service to it. We're full of rhetoric about the member is the center of the plan, the individual is so important, the family is so important. One of the elements that's working within managed care is that there are nearly 4,000 people in family care, or a smaller number growing in partnership, who are directing their own support in one way or another. And that support often is hiring people that they choose. Sometimes it's family members and friends and relatives. Other times it's direct support professionals who they hire. Sometimes it's hiring agencies. And as agencies out there, I think we're just beginning to understand the power of self-directed support in creating greater flexibility and opportunity for service providers. In our old county-based system, typically for people with developmental disabilities anyway, county program coordinators would have contracts with a relatively small number of agencies. And as agencies, you pretty much did what they asked you to do. And there were 72 counties, there weren't quite so many human service departments, but a relatively small number of folks were making the decisions about what you as providers did and then what you could offer to individuals. What family care and IRIS, particularly with self-directed supports within family care and what IRIS offer, is not only valuing each person, the expertise that each person has, that their families have, that their circle of supports and friends and community members have, but it also values the expertise and creativity that providers have to say, you don't have to do what a contract administrator says, this is all we want from you. Now you can look towards each person and find from each person what do they want from you, what do they need from you. One of the sometimes people forget this, the unbundling of services. It's really, what is it that you know best and can do best with providers? What do people want from you? And that's what we're seeing now. One of the ways that we talk about setting the bar, one of the ways we're setting the bar high in Wisconsin is very quietly, with almost no one knowing about it, we are becoming one of the places in North America that is most providing services to folks with disabilities and elders through what we refer to as self-directed supports, other states refer to as self-determination. We now have nearly 2,000 people served in the Mind Care program. I suppose the Irish people get upset with me, I just keep saying that over and over again. But that's fantastic. With little fanfare, and starting a little more about 21 months ago with 6 people the first month, and last month, 250 people referred themselves to Iris. So it's gone from a program with no marketing, with no fanfare, that is growing rapidly. As I mentioned earlier, within family care, we have about 4,000 folks who are now directing one or more services. And it's cost effective. It is one of the ways that we can make a difference if we truly reach out. That partnership, we've heard the partnership word a lot today. That sometimes we forget that the partnership truly does start with the individuals and families we support. Family care needs to get better at that. Iris also needs to get better at that. And reaching out and saying to each person, we want you involved. We want your ideas. We want the resources that you can bring in a variety of ways. As we do that, I think that we will, I'm not going to say that that's self-directed support is the magic bullet that will save all of our financial woes. It won't. There isn't one. But it's a significant part of it. And as we look at whether it's an audit or whether it's just the work that we do together to review how we sustain family care and Iris over the years, I think we will clearly see that self-directed support is a key element of making that happen.